What I'm about to show you is going to change the way you look at every single blood pressure pill sitting in your medicine cabinet. Because if you're taking Amlodipine, Losartan, or Lisinopril, there's a very real chance that one symptom you've been dismissing as age, stress, poor sleep, or just a bad day is actually your body trying to warn you that your medication is affecting you in a way no one fully explained. And that's the part that frightens me, because people don't usually get hurt by these medications only when they're prescribed incorrectly. They get hurt when they don't understand what the medication is actually doing inside them, and they miss the clues until something serious happens. Before we begin, please subscribe to my channel so you never miss clear life-saving health guidance designed to protect you. I'm Dr. Olivia Carter. And if you've been told to take Amlodipine, Losartan, or Lisinopril to lower your blood pressure, there are 11 things you need to understand right now. Not because your doctor is hiding them from you, but because most appointments are too short, most explanations are too rushed, and most patients leave with a bottle in their hand and only half the information they actually need. By the end of this video, you're going to understand which side effects are common, which ones are dangerous, which ones sound harmless but absolutely are not. And why the most important truth of all has nothing to do with the number on your blood pressure monitor and everything to do with whether you can safely stay on the medication long term. Let me start with Gloria, because her story explains why this conversation matters so much. Gloria was 72, organized, disciplined, the kind of patient every doctor hopes for. She took her medicine exactly as prescribed, kept her follow-up appointments, and never skipped a dose. Her blood pressure improved beautifully on paper. Everything looked perfect. But 3 months later, she was sitting in my office telling me her shoes no longer fit. Her ankles looked puffy every evening, and she felt strangely heavy by bedtime. She thought she was gaining weight. Her daughter thought maybe it was her heart. Gloria was terrified. And what nobody had fully explained to her was that the medication doing the right thing for her blood pressure was also causing a very specific side effect that can fool people into thinking something else is wrong. And that brings us to number 11. The first thing doctors often don't have time to spell out clearly. These 3 medications are not interchangeable pills wearing different labels. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACCE inhibitor. They all lower blood pressure, yes, but they do it in completely different ways, which means they create completely different patterns of side effects. If you don't understand that, you'll misread what your body is telling you. You'll think, all blood pressure medicine works the same. It doesn't. Amlodipine tends to relax blood vessels in a way that commonly causes swelling in the lower legs. Lisinopril is famous for a dry cough. Losartan is often chosen when someone can't tolerate that cough. Same goal, different pathway, different clues. Now, here's why that matters more than people realize. If you start coughing on Lisinopril and assume it means all blood pressure medicines will make you cough, you may stop treatment completely. If you swell on Amlodipine and assume your heart is failing, you may panic unnecessarily. If you feel fine on Losartan and assume there's nothing to monitor, you may miss a potassium problem building quietly in the background. The first hidden truth is simple but powerful. The name on the bottle tells you the class, and the class tells you the pattern. Once you understand the pattern, you stop being surprised by your body. And once you stop being surprised, you make better decisions faster. And that can prevent a medication side effect from turning into a medical emergency. Number 10 is the one Gloria was living through without knowing it. Amlodipine can cause ankle and leg swelling. And this swelling is one of the most misunderstood side effects in all of blood pressure medicine. People think it means they've eaten too much salt, or they think they're retaining water from weak kidneys, or they think they're becoming less active and putting on weight. But with Amlodipine, the swelling often happens because the small arteries relax more than the veins do. Blood flows into the legs more easily than it flows back out. Pressure builds in the tiny vessels, and fluids start slipping into the tissues around the ankles and feet. That's why people often say, I'm fine in the morning, but by evening my socks are leaving marks. Let me tell you about Arthur. Arthur was 76, and every afternoon his ankles looked bigger than they had in the morning. He thought, it was just part of getting older. Then he started sleeping with his legs propped up and noticed the swelling improved overnight, only to return later in the day. He never connected it to the amlodipine he had started 6 weeks earlier. What made this dangerous was not just the swelling itself, it was the silence around it. He didn't want to bother his doctor. He kept taking the medication, kept getting more uncomfortable, and eventually started skipping doses on the days he wanted to go out because he was embarrassed by how his legs looked. That is how a manageable side effect turns into uncontrolled blood pressure. The swelling may not mean the drug is wrong forever, but it absolutely means the conversation needs to happen. Number 9 is something people brush off for far too long. Lisinopril can cause a dry, persistent, nagging cough. And what doctors often don't emphasize enough is that this cough does not always begin right away. Sometimes it starts within days, sometimes within a couple of weeks, and sometimes it appears after months, which is why people miss the connection. They blame allergy season, dust in the house, acid reflux, a lingering cold, or dry winter air. The cough usually feels scratchy, irritating, stubborn, not wet, not productive, not dramatic, just relentless. And because it often gets worse at night, people think their lungs are the problem when the real issue is the medication sitting quietly in their pill organizer every morning. Helen learned this the hard way. She was 69, and 4 months after starting Lanapil, she developed a tickle in her throat that wouldn't go away. Then came the nighttime coughing fits. Her sleep got worse. Her energy dropped. She started waking up exhausted and assumed maybe she was just getting older, or maybe her reflux had returned. She bought Losartans, changed detergents, even replaced the air filter in her home. Nothing helped. When I asked when the cough began, relative to the medication, she looked stunned. She had never been told that Lisinopril cough can arrive late, and once I explained it, everything clicked into place. This matters because many patients quietly suffer with that cough for months. And a lot of them eventually stop the medication on their own without telling anybody, which is exactly what we do not want. But there's something even more important hiding behind this, and I need you to hear me clearly. A dry cough on lisinopril is usually not the same thing as a dangerous allergic emergency. The symptom that should terrify you is swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult. That is not a wait-and-see situation. That is not a call the office Monday situation. That is emergency care. Now, ACCE inhibitors like lisinopril can in rare cases cause angioedema, and it can become life-threatening very quickly. ARBs like Losartan can very rarely be linked to similar swelling too. But the classic concern is with ACE inhibitors. So if you hear me say cough, don't panic. If you hear me say tongue or throat swelling, that is the moment you move fast. Number 8 is one of the most dangerous truths in this whole video because it hides in plain sight in the grocery store. If you take Losartan or lisinopril, potassium matters. And most people hear that sentence and think, fine, I don't take potassium pills, so I'm safe. Not necessarily, because potassium doesn't just come in a supplement bottle. It shows up in salt substitutes, heart-healthy seasoning blends, electrolyte powders, some meal replacement drinks, and over-the-counter products people use without thinking twice. Losartan and lisinopril can both raise potassium levels. And high potassium can become dangerous because it affects the electrical rhythm of your heart. It may not announce itself loudly at first. It may show up as weakness, muscle cramps, tingling, fatigue, palpitations, or sometimes hardly any symptoms at all. Let me tell you about Robert. Robert was 74 and had been trying so hard to be healthy. He cut down sodium, started reading labels, and proudly switched to a salt substitute because he thought he was doing exactly what his heart needed. What he didn't realize was that many salt substitutes replace sodium with potassium. So now he was taking Losartan, which can increase potassium, and seasoning every meal with extra potassium on top of that. He started feeling weak and a little off, then noticed occasional skipped beats in his chest. By the time his labs were checked, his potassium was high enough to demand immediate attention. And the tragedy is that Robert was not careless. He was trying to be compliant, trying to be good, trying to follow the rules. Nobody had simply connected the dots for him. And that gap in education is where patients get hurt. Number 7 is the truth about kidney numbers. And this one confuses people so badly that they sometimes stop their medication just when it may be doing something protective. Losartan and Lisinopril are not just blood pressure drugs. In the right person, they can also protect the kidneys and the heart over time. But when you first start them or when the dose is increased, your doctor may check blood work and see a small change in kidney function, such as a rise in creatinine or a dip in eGFR. To many patients, that sounds like proof the medicine is damaging the kidneys. Sometimes it can be a problem, yes, but sometimes a small early shift is expected because these medications change pressure dynamics inside the kidney's filtering system. That's why the blood test matters and why guessing is so dangerous. Sharon nearly made that mistake. She was 71 and had both high blood pressure and early kidney disease. Her doctor started Lisinopril specifically because it could help protect her kidneys long-term. A couple weeks later, her labs changed slightly. She saw the results in her patient portal before anyone called her, panicked, and decided the medicine must be hurting her kidneys. She was one click away from stopping it. That same night, when we spoke, I explained that the key question wasn't just, did the number move? The key question was, how much did it move? What was the trend? And what else is happening in the body? A mild expected change under supervision is very different from a dangerous decline. That's why lab follow-up is not optional theater. It is part of the treatment itself. Because these drugs are powerful and useful, but only when they are monitored intelligently. And this leads directly to number 6, which is one of the most overlooked dangers in older adults. Dehydration changes everything. If you are taking Losartan or Lisinopril, and then you get vomiting, diarrhea, a stomach bug, poor appetite, or heavy sweating in hot weather, the medication that was helping you yesterday may hit you very differently today. Your blood pressure can fall too low, your kidneys can become stressed, you can feel dizzy, weak, or faint. In some cases, you can slide into acute kidney trouble much faster than you realize. The medication didn't suddenly become evil. The body's fluid balance changed, and now the same dose is acting in a completely different internal environment. This is one of the most important nobody told me moments in blood pressure care, because people keep taking the same pills through illnesses that dramatically alter their hydration. Frank was 78 when this caught up with him. He had a bad stomach virus, couldn't keep much down, and still took his usual Losartan every morning because he was proud that he never missed medication. That night, he stood up from the couch, the room spun, and he nearly collapsed. In the emergency department, the problem wasn't that Losartan was a bad drug. The problem was that his body was depleted. He had lost fluids. His blood pressure had bottomed out and his kidneys were under strain. What he needed was not blind obedience to the pill bottle. He needed a plan for sick days. He needed to know when illness changes the rules and when to call for guidance instead of powering through. That kind of practical advice is not dramatic, but it prevents suffering. And it prevents the very dangerous idea that medication should be taken, no matter what the body is doing. Number 5 is the hidden trap sitting in millions of medicine cabinets, and it has nothing to do with prescription drugs at first glance. Ibuprofen, naproxen, a handful of just for my back, just for my knee, just for the weekend gardening pain. If you are taking Lisinopril or Losartan, especially if you also take a diuretic or water pill, regular use of certain anti-inflammatory pain medicines can create a perfect storm for the kidneys. This is one of those interactions that shocks patients, because every piece feels ordinary on its own. Blood pressure pill, a pain reliever, maybe a diuretic. Nothing sounds dangerous, but together in the wrong situation, especially with dehydration, they can reduce blood flow to the kidneys and increase the risk of kidney injury. And most people don't tell their doctor about the over-the-counter pain medicine because they don't even think of it as medicine, just as something from the drugstore. Carol did exactly that. She was 73, took Lisinopril for blood pressure and a water pill for leg swelling, and used ibuprofen several times a week for arthritis in her hands. She thought she was managing beautifully. Then her labs worsened. Her blood pressure got more erratic, and suddenly everyone was scrambling to figure out what had changed. It wasn't a mystery, it was the interaction. And once we removed the daily anti-inflammatory, reviewed safer options, and tightened up her monitoring, things improved. But this is what I need you to understand. Many patients think medication dangers come only from rare side effects listed in tiny print. In reality, some of the biggest dangers come from common combinations nobody reviews carefully enough. If you take Losartan or Lisinopril, over-the-counter pain medicine is not a casual topic. It is a serious safety topic. And it deserves a real conversation. Number 4 is the side effect people normalize until it becomes a fall. Dizziness, lightheadedness, that woozy moment when you stand up too fast, the weak feeling after the first few doses. With all 3 of these medications, especially when starting them or increasing the dose, your body may need time to adapt to a lower blood pressure. That can mean dizziness, especially when moving from lying down to standing. People laugh it off. They say, "Oh, I just got up too fast." Maybe. But in older adults, a few seconds of dizziness can become a fractured wrist, a head injury, or a broken hip. And here's what people don't realize. Sometimes dizziness means the medication is doing its job a little too aggressively for your current body, your current hydration, or your current combination of medications. Joseph was 80 and prided himself on independence. He lived alone, moved carefully, and hated asking for help. 2 days after starting a higher dose of Amlodipine, he stood up in the bathroom in the middle of the night and felt the world tilt. He grabbed the sink just in time. He didn't fall, but it scared him badly. When I asked whether anyone had warned him to rise slowly, sit on the edge of the bed first, and watch closely for persistent weakness or near fainting, he shook his head. He had been told the medication might lower his pressure. He had not been told what that might actually feel like in a real body moving through a real house in the dark. That is the difference between prescribing a drug and preparing a patient. Mild dizziness may improve. Fainting is not something to ignore. And repeated dizziness is not something to silently endure. Now we move to number 3. And this is where so many intelligent people accidentally sabotage their treatment. They look at one blood pressure reading, see a high number, and conclude the medication is failing. Or they see one low number and decide the medication is too strong. That is not how blood pressure works. Blood pressure moves. It changes with sleep, pain, stress, talking, posture, meals, caffeine, and anxiety about the reading itself. A single number is not a verdict. It is a snapshot. What matters is pattern. What matters is consistency. What matters is what your body is telling you over time. Not what one startled glance at the monitor told you on a Tuesday morning after bad sleep and a rushed trip to the bathroom. Medications like Amlodipine, Losartan, and Lisinopril should be judged by trends, not panic. Diane was 67 and checked her blood pressure whenever she felt worried. If she had a headache, she checked it. If she read a stressful headline, she checked it. If she got a high reading, she checked it again 2 minutes later. Then again, until she had a page full of numbers and a heart full of fear. She was certain her Lysin wasn't working. But when we slowed everything down, used the same times each day, and had her rest quietly before measuring, a very different picture emerged. Her medication was working reasonably well. The chaos was in the method, not the medicine. And this matters because once people believe their medication has failed, they start making impulsive decisions. They take extra doses, they skip doses. They demand a change based on noise. Good medicine plus bad interpretation creates bad outcomes every single time. Number 2 is about timing. And I cannot overstate how often this creates unnecessary danger. These medications work best when taken consistently. Same general time, same routine, same system. If you miss a dose, the answer is not usually to double up later unless a clinician has given you very specific instructions. Many patient instructions for these drugs say to take the missed dose when you remember unless it is close to the next dose. And if it is close, skip it and resume the normal schedule. Do not take 2 at once. Yet, people do it all the time because they're afraid of their pressure climbing. Then they get dizzy, weak, or frightened by a drop they cause themselves. Consistency is not boring. Consistency is what turns a prescription into a stable treatment plan rather than a daily gamble. Martin was 75 and took his medication faithfully, except when he didn't. If he forgot his Lisinil in the morning, he'd take it at lunch. If he remembered again before dinner, he'd convince himself it was safer to take another just in case. Once after a high home reading, he took an extra tablet because he didn't want to risk a stroke overnight. That decision landed him in bed the next day feeling washed out and unsteady. He hadn't failed because he was reckless. He failed because nobody had drilled into him that blood pressure medicines are not rescue pills for random spikes. They are long-game medications. They work through steady use, not emotional reactions. If you don't know what to do when you miss a dose, ask. If you're not sure whether you can split timing or combine pills, ask. Guessing with these medicines feels small in the moment, but it can create very big problems. And now we arrive at number 1. The most important thing doctors often do not fully say out loud. The best blood pressure medication is not the one that gives you the prettiest number for 3 weeks. It is the one you can stay on safely, consistently, and intelligently, because it fits your body, your symptoms, your other illnesses, your lab results, and your life. That is the truth people miss. A blood pressure medication can look successful on paper, while failing in the real world because you hate how it makes you feel. You don't understand its warning signs, or you've quietly started avoiding it. Amlodipine may work beautifully for one person and cause miserable swelling for another. Lisinopril may protect kidneys and control pressure wonderfully, but a dry cough can ruin sleep. Losartan may be a great alternative, but it still demands respect for potassium, kidneys, and hydration. Let me tell you about Teresa because her story brings all of this together. Teresa was 70 and had excellent blood pressure numbers on Lisinopril. Any doctor glancing at the chart would have smiled, but Teresa was coughing every night, sleeping terribly, and beginning to dread the pill. She didn't tell anyone because she assumed the answer would be, well, you need it, so just live with it. That assumption is where patients disappear. First, they resent the medication. Then they start forgetting it on purpose. Then they stop it entirely. Then the blood pressure rises again, and everyone acts surprised. Teresa did not need a lecture. She needed a medication plan that fit her actual body. Once the cough was identified as likely medication-related, her clinician was able to reassess and adjust. That is good care. Not push through at all costs. Not suffer silently because the number looks nice. Real care means the person matters as much as the pressure. This is what doctors won't always tell you clearly enough. Side effects are not personal weakness. They are data. Swelling is data. Cough is data. Dizziness is data. Weakness after dehydration is data. A strange pounding heartbeat, persistent lightheadedness, worsening fatigue, muscle cramps when potassium is off. Those are all pieces of information. Your job is not to diagnose yourself. Your job is to notice the pattern and report it. Too many people think being a good patient means never complaining. Absolutely not. A good patient pays attention. A good patient speaks up early. A good patient doesn't wait until their throat is swelling, their kidneys are struggling, or their blood pressure is uncontrolled because they quietly stopped the medicine 3 weeks ago, without telling anybody. Silence is not strength here. Silence is risk. And risk grows in the dark. So let me give you the practical framework I want you to remember every time you take Amlodipine, Losartan, or Lisinopril. If you take Amlodipine, watch for ankle swelling, flushing, headaches, dizziness, and that heavy leg feeling by evening. If you take Lisinopril, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. If you take Losartan, watch for dizziness, weakness, illness-related dehydration, and signs that potassium may be drifting too high, such as muscle weakness, cramping, pins and needles, or an irregular heartbeat. With Losartan and Lisinopril especially, blood tests matter. With all three, consistency matters. And with every single one of them, a symptom you can't explain is worth discussing. Do not wait for certainty. You do not need certainty to make a phone call. Only a pattern that concerns you. I also need you to understand something else that can save you from a great deal of fear. Not every side effect means catastrophe. Mild headache when starting Amlodipine may improve. Mild dizziness when first lowering blood pressure may settle as your body adapts. A dry cough on Lisinopril can be bothersome without being dangerous. But not every side effect should be endured indefinitely. Either there's a difference between this may improve in a few days, and this is stealing your quality of life. Patients blur those lines all the time. They either panic over a manageable symptom or they minimize a serious one. The answer is not panic, and it is not denial. The answer is interpretation, and interpretation gets better when you know what class of drug you're taking, how it behaves, and what red flags cross the line from nuisance to urgency right away. Now think about how many people live with blood pressure medication in a fog of half-knowledge. They know the name, they know the dose, they know they have to take it, but they do not know why the ankle swelled, why the cough started, why the labs changed, why their doctor asked about ibuprofen, why dehydration suddenly mattered, or why a salt substitute could become dangerous. That fog creates fear, and fear creates bad decisions. The moment you understand the mechanism, so much of that fear dissolves. You stop imagining that every symptom means the worst, and you stop pretending that obvious symptoms mean nothing. That balance is where safety lives. Not in ignorance, not in obsession, in understanding. And once you understand, you become far harder to harm, because you stop being passive with powerful medications. If this helped you, share it with someone taking blood pressure medication, because there is a very good chance they need this information too. And as always, I'll be here in the next video to help you understand the health truths that matter before they become the emergencies you never saw coming. And that is exactly why this channel exists.